A possible Ebola case has prompted a Denver hospital to go into temporary lockdown, with emergency crews in hazmat suits responding to the scene. Denver Health Medical Center, one of 10 regional facilities designated to handle Ebola cases by the CDC, received the possible Ebola patient at 8:30 a.m. on Sunday, the hospital said in a statement. Officials said the patient had recently returned from the Democratic Republic of Congo, where they had handled the sick and deceased during a recent Ebola outbreak. The patient was rushed into an isolation unit and is being evaluated in fair condition. Emergency crews in hazmat-style suits were seen entering the building on Sunday afternoon by CBS Denver. Share this article. The medical facility was briefly put on lockdown, with ambulances diverted to other hospitals, but normal operations had resumed by Sunday afternoon. In a statement, the hospital said that Ebola was being considered as a potential but unlikely diagnosis. From an initial review of the situation and the symptoms presented by the patient, it is unlikely that this will be confirmed as an Ebola case, said Dr. Connie Price, an infectious disease physician and chief medical officer at Denver Health. The hospital urged calm, saying there was no threat to patients, visitors or staff at the facility, with isolation protocols in place. The Ebola virus is extremely deadly, but is only known to be spread through direct contact with bodily fluids. The last significant outbreak, which killed 33 people in the Democratic Republic of Congo, was declared over just last week. What is Ebola, and how deadly is it? Ebola, a hemorrhagic fever, killed at least 11,000 across the world after it decimated West Africa and spread rapidly over the space of 2 years. That pandemic was officially declared over back in January 2016, when Liberia was announced to be Ebola-free by the WHO. The country, rocked by back-to-back civil wars that ended in 2003, was hit the hardest by the fever, with 40% of the deaths having occurred there. Sierra Leone reported the highest number of Ebola cases, with nearly of all those infected having been residents of the nation. Where did it begin? An analysis, published in the New England Journal of Medicine, found the outbreak began in Guinea, which neighbors Liberia and Sierra Leone. A team of international researchers were able to trace the pandemic back to a 2-year-old boy in Miliandu, about 400 miles (650 kilometers) from the capital, Conakry. Emile Luamauno, known more commonly as Patient Zero, may have contracted the deadly virus by playing with bats in a hollow tree, a study suggested. Figures show nearly 29,000 people were infected from Ebola, meaning the virus killed around 40% of those it struck. Cases and deaths were also reported in Nigeria, Mali and the US, but on a much smaller scale, with 15 fatalities between the three nations. Health officials in Guinea reported a mysterious bug in the southeastern regions of the country before the WHO confirmed it was Ebola. Ebola was first identified by scientists in 1976, but the most recent outbreak dwarfed all other ones recorded in history, figures show. How did humans contract the virus? Scientists believe Ebola is most often passed to humans by fruit bats, but antelope, porcupines, gorillas and chimpanzees could also be to blame. It can be transmitted between humans through blood, secretions and other bodily fluids of people and surfaces that have been infected. Is there a treatment? The WHO warns that there is no proven treatment for Ebola, but dozens of drugs and jabs are being tested in case of a similarly devastating outbreak. Hope exists though, after an experimental vaccine called RVSV-Zevov protected nearly 6,000 people. The results were published in the Lancet journal.